Understanding mental awareness. The global impact of depression and its socio-economic ties. Introduction. Mental awareness has become a crucial topic as societies around the world grapple with rising rates of mental health disorders, particularly depression. Depression is more than just a feeling of sadness. It's a serious medical condition that can have profound effects on individuals and societies alike. Understanding the different types of depression, its relationship with economic conditions, and its societal impacts is key to addressing this global challenge. Types of depression. Depression manifests in various forms, each with its own set of symptoms and severity. Understanding these types is essential for recognizing the condition and seeking appropriate treatment. Major depressive disorder, MDD. The most common form, characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities once enjoyed. Symptoms must last for at least 2 weeks for a diagnosis. Persistent depressive disorder, PDD, also known as dysthymia. This is a chronic form of depression with less severe but longer-lasting symptoms, often lasting for 2 years or more. Bipolar disorder. A condition where individuals experience extreme mood swings, including episodes of depression and mania, a state of heightened energy and activity. The depressive episodes in bipolar disorder can be as severe as those in MDD. Seasonal affective disorder, SAD. This type of depression typically occurs during the winter months when there is less natural sunlight. It is often associated with changes in circadian rhythms and can improve with the return of sunnier days. Postpartum depression, PPD. This form of depression affects new mothers, typically within the first few weeks to months after childbirth. It can significantly impact a mother's ability to care for her newborn. Psychotic depression. A severe form of depression where the individual experiences symptoms of major depression along with psychotic symptoms, such as hallucinations or delusions. Depression and economic conditions. Economic conditions play a significant role in the prevalence and severity of depression. Financial instability, unemployment, and poverty are closely linked to higher rates of depression. Conversely, depression can also exacerbate economic hardships, creating a vicious cycle. Unemployment. Job loss and unemployment can lead to a loss of self-esteem, social isolation, and financial stress, all of which are risk factors for depression. Economic recessions often see a spike in depression and suicide rates. Poverty. Living in poverty can increase the risk of depression due to the chronic stress associated with financial insecurity, lack of access to healthcare, and social marginalization. Economic inequality. Societies with high levels of income inequality tend to have higher rates of mental health issues, including depression. The stress of living in an unequal society, where social and economic disparities are stark, can contribute to feelings of inadequacy and hopelessness. Societal impact of depression. Depression is not just an individual issue. It has far-reaching effects on society. The World Health Organization, WHO, estimates that depression is the leading cause of disability worldwide, affecting over 280 million people. The societal impacts include economic costs. depression can lead to reduced productivity, increased absenteeism, and higher healthcare costs. It is estimated that the global economy loses trillions of dollars annually due to depression and anxiety disorders. Social strain. Depression can strain relationships, leading to social isolation and reduced community cohesion. It can also impact family dynamics, especially when a parent or caregiver is affected. Public health. Depression is often associated with other health problems, including cardiovascular disease, diabetes, and substance abuse. This comorbidity further strains healthcare systems, particularly in low-income countries where resources are limited. Treatment options for depression. Treating depression requires a multifaceted approach, often combining medication, psychotherapy, lifestyle changes, and social support. The effectiveness of treatment varies depending on the type and severity of depression. Medication. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed to help balance brain chemicals. These medications can be effective, but they often come with side effects and may take several weeks to work. Psychotherapy. Cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, are two widely used forms of therapy for depression. Psychotherapy helps individuals identify and change negative thought patterns and behaviors contributing to their depression. Lifestyle changes. Regular exercise, a healthy diet, adequate sleep, and mindfulness practices such as meditation can significantly improve symptoms of depression. These changes help reduce stress and improve overall well-being. Social support. Building a strong support network, whether through family, friends, or support groups, is crucial in managing depression. Social connections provide emotional support and can help individuals feel less isolated. Emerging treatments. New treatments, such as transcranial magnetic stimulation, TMS, and ketamine therapy, are showing promise for individuals with treatment-resistant depression. These approaches are still being studied, but early results are encouraging. The cost of treating depression. The cost of treating depression varies widely depending on the type of treatment, the country, and whether the individual has access to health insurance. Medication costs. Generic antidepressants can cost as little as $4 to $20 per month, while newer brand name medications can be significantly more expensive, ranging from $100 to $300 per month without insurance. Therapy costs. Psychotherapy sessions can range from $60 to $250 per hour, depending on the therapist's credentials and location. Some therapists offer sliding scale fees based on income, and many health insurance plans cover a portion of therapy costs. Hospitalization and intensive care. In severe cases, hospitalization may be necessary, which can be extremely costly. A short stay in a psychiatric hospital can cost thousands of dollars per day, though insurance may cover some of these expenses. Long-term costs. Without proper treatment, depression can lead to long-term disability, lost income, and ongoing healthcare costs. far exceeding